the Quest 2 study that brought a better outcome of stenting versus medical treatment alone. Good morning, everybody. My name is Eric Steinmetz. I am a French vascular surgeon, academic in the Academic Hospital of Dijon in Burgundy, and I'm also the current secretary of the French Society of Vascular Surgery. So I'm very proud to be here in Paris for the 2025 PVI session. I was involved this morning in a joint session between the French Society and the German Society for Vascular Surgery, and we try to share our experiences about 3 different subjects. So I was in charge to speak about asymptomatic carotids. How do we treat them? Do we keep them on medical treatment only, or do we operate on them with endarterectomy or with stenting? You know that there was a recent game changer, the Quest 2 study that brought a better outcome of stenting versus medical treatment alone, but no significant advantage of endarterectomy as compared to medical treatment alone. So this may be a game changer. It's too early to know that, but it's who brings the stent back in the course. The second topic was done by my colleague Fabien Tabou, academic surgeon in Clermont-Ferrand, who spoke about training, and we shared our experience between Germany and France about training. And it turned out to be very comparable, very close one to each other. And the last topic was about the threshold of the elective operation for AAA. Should we keep the threshold at 5.5 centimeters, even if in France we suffer of a certain operate even at 5 centimeters? Or should we also include the frailty score and the comorbidities of the patient? And once again, we have a lot of similarities between the way we treat AAA patients in France and in Germany. Thank you.